Hello, everybody online now. I'm Stefano Vella. I'm from Italy. And I've been working for G20, for T20, but now I'm very honored to moderate this session of C20 because being an so-called expert of HIV/AIDS battle for years, I know the role of the community for everything. The community is key. And this is indeed the community G20. Now, the topics today deals with the fact that we are not vaccinating the world. The rich part of the world is vaccinated, but not the poor's, as usual. This reminds me of many years ago of the divide regarding antiretrovirals and HIV, etc. The story repeats itself. So I'm very glad to introduce, first of all, I think Mrs. Karine Duverger from Haïti. Bonjour.
Bonjour.
Vous parlez français, je pense, moi aussi.
Bien sûr, merci.
Mais je pense que vous allez parler en anglais.
Bien sûr, aujourd'hui c'est en anglais.
Très bien. So, thanks again for being with us. And we look forward to your talk. That should take around, 10, 12 minutes to have time for some questions from the floor, if they come. So thank you. The floor is yours.
Thank you. I guess, thank you for having me. Thank you, Dr. Villa. I have to say good morning, good afternoon, good evening, everyone around the world. The COVID-19 pandemic is yet another crisis among many others that Haiti is facing. Haiti did receive 500,000 doses of the COVID-19 vaccine from the US, which is not enough to reach the need of the Haitian population. As of today, we only have 0.1% of Haiti that is vaccinated. And the first batch did not arrive until July 2021. By contrast, we have the Dominican Republic, which share the borders with Haiti. 45% of the population already has been vaccinated. As we know, the rich countries right now have a surplus of 1.2 billion vaccine. With that said, we only need 0.01% for this amount for the entire population of Haiti to be vaccinated. We have the G20 countries in the America, including United States, Mexico, Brazil, Canada. I think they should unite to ensure that their neighbors, like Haiti, get equitable access to the vaccine. Also, that's the only way, I think, right now to ensure that we have the regional stability, return to the economic growth, also the tourisms and health security in America and the Caribbean region. Specifically, I think this country should donate more doses to countries like Haiti. On the global level, the G20 country, they should support the expansion of vaccine production around the world. And not to be long, I want to end saying Haiti actually need the assistance to a major awareness campaign on education, better information regarding why it is a necessity, is a benefit to take the COVID-19 vaccine. Thank you.
I would like to thank you. Very strong message. I have a question for you. Why the Dominican Republic is quite well vaccinated? You have an explanation of this divide?
Why I can say that the Dominican Republic exactly with the country G20 countries have that relationship where the support is getting it's more strong than Haiti. And I guess I should say Haiti is in the back burner where right now we need the support and there's so many things going on, so many crises, and the support is definitely needed from those G20 countries.
I understand. The problem, again, I don't know if other speakers will touch on that, is that I am personally against the issue of donations, because vaccination is a right, is not through donations, because the rich part of the world always speak about donation. We will donate, but it's not a donation. You know what I mean? We need to build something stronger than a donation. Even the surplus doses, I don't want them. No, I'm joking. I would like them to join Haiti. But it's the issue of donation, which is a little bit... Anyway, I thank you very much. And now I think I have Prince Mandendra from India, a country that I like very much. From where are you? From which part of India are you?
I'm from the western part of India, which is closer to Mumbai. It was called Bombay, now it is called Mumbai. I'm very close to Mumbai.
I've been in Mumbai many times because I have a lot of friends there. We worked for HIV/AIDS for years. So now the floor is yours, Prince. Thank you very much for being here with us.
Thank you, Dr. Vela, for giving me this opportunity. So, India, we've had unique case with regards to COVID. I mean, we have to understand that India is a highly populated country with a density per square kilometer, square mile is extremely high. In certain pockets of India, there's a very densely populated country. So, any pandemic, or whether it's HIV or as an epidemic or anything which happens, it spreads really fast, and it's very difficult to even know how it is spreading, and very difficult to control in certain cases. I mean, since I have been working on behalf of AHF as a brand ambassador for India for HIV issues, I know how difficult it is to work, how challenging it is to work in India. So, having said that, let me run you through some of the facts in India. I mean, the COVID-19 was a very devastating situation in India, and some of the figures I can read out, like almost 450,000 people have been dead because of this pandemic, and it had peaked sometime in the month of April last year, and we had the first lockdown was declared in the end of March 2020, lasting almost close to end of June, and thereafter we had another second wave which hit in 2021, and that also lasted almost 3 months. Now, it was necessary to put this lockdown because of the, as I mentioned to you about the population, about even the migration. I mean, India ranks amongst one of the highest migration in, which happens in the world. And because of that, also it is difficult to control. And because of the lockdown, it had a serious, economic impact on the country with unemployment, with poverty, and many things, many economical situations have resulted in it. But there is another good thing which has happened in India, that India was one of the foremost countries where it started distributing the vaccines to many countries, many developing countries. I would say many countries who are not able to afford the vaccine. So almost close to 95 countries it has distributed the vaccinations. So that's something I would say is which India has managed to do. So so it has also been responsible for implementing a TRIPS waiver for the vaccine patents. So it has taken some steps to ensure how hoarding could reduce, how and patents could be waived to ensure that the VOW, which this campaign which was launched. I mean, much before that, India has already taken some steps. So that's that way. We have done some remarkable things as well. Yes.
Yes, thank you very much. Actually, I have a question for you and for the public who may follow us. India is a great producer of vaccines. And I know that the AstraZeneca vaccine was produced in India. And you said that this vaccine at the beginning was distributed to many countries, correct? It was.
Yes.
But then I think you need your vaccine, the vaccine for, what's the coverage in India now, approximately? How many are vaccinated?
So at the moment, I mean, I don't have the figures with me how many have got vaccinated, but yes, definitely not many have got vaccinated. I would say not more than 30% of the country has got vaccinated. So there is still a lot of vaccination needs to be done, and India is now expanding its vaccination production as well. I mean, I would also like to quote about. Recently, I kind of just got to know about a mail which came from the Biden administration. They have quoted that India is very soon going to play a very important role in bringing the pandemic to an end. And this has been quoted by a USAID administrator, in which they have mentioned that that it's going to expand its vaccine manufacturing capacity. So that will help providing vaccination within the country, as well as it would have enough to distribute to many other countries. So and I think sorry.
No. I was saying that today, to expand vaccination to the globe, we need also a lot of technology transfer.
Yes, exactly.
For example, to Africa. So we need local production, and India could play an important role in technology transfer to have vaccines produced locally.
Right. So what India has done is that they have started a program which is called Vaccine Maitri. Maitri is an Indian word. Maitri means friendship. So under this Vaccine Maitri program, it plans to meet its commitment for the COVAX global pool. And this is being led by the Coalition for the Epidemic Preparedness Innovations and WHO. So that's what is the next plan for India. And we have done a lot of advocacy at the ministry level as well. I mean, I personally know the Health Minister of India. He's just been newly appointed and by the government, and I happened to have a meeting with him. He in fact comes from my state as well. I mean, I'm from the state of Gujarat, where even our Prime Minister Modi comes from the same state. So I had the fortune of meeting the minister and congratulating him for the role India has taken for VOW campaign, which was launched. But of course, India has already taken steps to ensure how the vaccines could be distributed to as many countries as possible. So and also we did a lot of advocacy with him, and he is fully in support of the VOW campaign. He is in fact visiting Rome as well for the G20 Summit. So we are in touch with him, and we are ensuring that the message goes across, and at least India will be able to influence a lot of countries to help us support the VOW.
Absolutely, you need to be supported and also to support. it's a double. So thank you very much. It was very, very enlightening. But then we may have another tour of conclusion. Now let's go to Africa. We have here Mr. Alan Maleche, is director of Kelly, and the floor is yours. Thank you for your point of view from Africa.
Stefano, thank you for, yes, I'm from Kenya, and thank you for having me on this conversation. And I just want to build up from what Karine and Prince Grohil have said and say that indeed there is a big worry about the fact that the issue of vaccine equity is quite a challenge of our time. And if you make a comparison between the high-income nations and the vaccine situation in Kenya and other African countries, it speaks of an unprecedented inequality, inequity, and a broken system in the face of a ravaging pandemic. And I think when I looked at the figures this morning before I was preparing for this, from a website called Our World in Data, it showed that only 4.6% in Africa had been fully vaccinated against COVID by today, October 6, 2021. And you can't compare this to other G20 countries. Say for the US, you have 55% of the population vaccinated. In Canada, you have 72% of the population vaccinated. In Germany, you have about 64. In France, 66. In Mexico, you probably have something close to 30% or 40% of those vaccinated. In South Africa, it's 16. So you can see there is a lot of inequality, and this is stemming from what you had mentioned earlier, that the charity for vaccines is actually not working. The donations are good, and I'll show you later why they're not working, but we have failed to treat COVID-19 vaccines as public goods. We fail to recognize this is an issue of the right to health, and everyone is entitled to a vaccine. Instead, we have turned vaccines to become a marketplace where those who can afford to pay the asking price are able to buy, they are able to hoard, and then when they don't have more use for them, they are then able to start donating as a sign of charity. Yet they're the ones who have created, and some of them are G20 members, who have created the problem of vaccine scarcity by buying more than what they need. And now they're struggling to push the vaccines out of their countries to be able to get other people vaccinated. But also what is annoying is that, and I posted this yesterday on social media platforms, the UK, which is a member of the G20, actually came up with a list of vaccines or countries where they recognize vaccines that have been issued. And in the list they issued, there was no country from Africa that was listed. Yet, it is the same UK that has been sending AstraZeneca vaccines to African countries to help ensure that those vaccination programs are able to happen. And so that's where the double standard happens. Why do you send us vaccines to use, and then you come up with a criteria and say vaccines from this country, we are vaccinated while you're in these countries, the UK is not going to recognize them. And if you come in, you have to get vaccinated again, or you have to go through quarantine. So that's a lot of iniquity. And then thirdly, everyone is running away from the issue of how do we use the legal binding documents in form of TRIPS that say during a public health emergency, you can share technology, you can waive patents, you should share data, and you should try to do good that ensures everyone gets vaccinated, because viruses don't respect borders. If everyone in the US, if everyone in the UK, if everyone in India gets vaccinated and those of us in Africa don't, you then run into the trouble of having variants, and the world is a global village, and people will continue to travel whether you force them to quarantine or not. And so if we don't see more global solidarity that allows for massive global vaccination campaigns, we won't be able to see the end of COVID. And I believe members of G20 have a major role to play in terms of ensuring that there's global solidarity that allows for technology transfer, that allows for sharing of information and data. Especially that would be important to help local manufacturing, reduce the cost of vaccines, and ensure that we don't have unfair distribution of vaccines across countries, or we are hoarding vaccines, or we are disregarding international law that we've already agreed upon, because I can only say such practices only border towards being racist and being discriminatory in the way that the rich countries are dealing with the poor countries. This is the time to show solidarity. This is the time to help build the health systems, because a strong health system in Africa is a good sign for Europe, is a good sign for America, is for a benefit for Asia. And so that solidarity is what is missing. And my clarion call to G20 members, this is the time to step up. This is the time to show this solidarity. Over to you, Stefano.
Thank you very much. You said very straight things. And I would add that it's not only solidarity, it's a right. So the rich countries are vaccinating their people, I understand, but we need to change the rules in a sense. I'm not just talking about the waivers about patents, because for vaccines, waivers is just a piece of paper. Vaccines needs technology transfer to, because vaccine is in a sense is a platform, is not a chemical. But anyway, I think we need to be imaginative. The Italian G20 is trying to do something in terms of putting together finances and help to find money to produce more vaccines. But then you touched a very important thing, which is absorptive capacity from the countries, because the vaccines needs to be injected, let me say. So you need a system, an organizational system that also allows people to get vaccinated. So we need the vaccines and a strategy, local strategy to vaccinate the people in the rural areas, for example, which is not easy. I see now Jorge Saavedra on my screen, an old friend from Mexico and public health from also in Miami. But I'm very curious to hear his voice. So the floor is yours, Jorge.
Well, thank you very much, Stefano, for moderating this panel. I think I will touch a little bit about Mexico and Latin America and about the global health governance model that has not worked during this crisis. As you know, the global governance model did not work well on assuring epidemiological transparency since the very beginning in China, and later because it was not possible to convince all countries to do the right things. Why? Because the way it was WHO designed, it was for a different era. It was after the World War II. And now we are in a similar situation in terms of deaths and in terms of global impact to World War III. And so it was designed differently with a lot of limitations imposed by the same countries that agree to be part of WHO. And right now, WHO, the way it is kind of weak and insufficient for the needs of this world, for the needs especially right now under the current pandemic. As you all know, Latin America has been the hardest hit region of the world in terms of deaths, probably not in cases, but in deaths. When you compare the deaths rates and the deaths concentration is about Latin America. It is being hit Latin America like it was the case of HIV/AIDS in Africa. In the case of Latin America, we all have someone, a close one, a relative, someone very near to us who has died because of COVID-19. So it's not something far away. I know that Italy also suffered a lot, especially during last year. But Latin America, during these 3 waves now, of COVID-19 cases has been really hit hard. But then you see Latin America, exception made for Haiti, and then I'll go back to Haiti. I know Corinne is here. But it's mainly upper middle income countries. So some of them or most of them is not an issue that they don't have money, they don't have resources. But countries like Mexico, for example, the government has the resources, and they say that we have all the resources needed to buy all the vaccines that are needed. But where do we buy them? Because there is not enough production. There is not enough global production. So Mexico is one of the countries that has been using almost all the vaccines globally available, from Pfizer, Moderna, Johnson & Johnson, AstraZeneca, Sinovac, CanSino, Sputnik. They have been using all, and it's still not enough vaccinations, not enough vaccines in Mexico. So it's not necessarily an issue of the price, but the production. So, but the capacity to produce vaccines, as you mentioned, Stefano, and also Prince Manvedra, India has a huge capacity to do so, but also Brazil has a huge capacity to produce vaccines. Argentina has, Mexico has, Colombia has. They do have that capacity, but why they are not doing it? They don't have the patents. They don't know the exact know-how. And even if they do have it or they can copy, they are not allowed to do it. So some of these countries are trying to develop their own vaccines, like Cuba and Mexico. They are trying to develop their own vaccines. But why, if we have effective vaccines, at least to prevent deaths globally? So that needs to be done. This technology transfer that you mentioned, but also the waiving of the patents so they can encourage others to produce it. And of course, the technology transfer needs to happen as well. I agree with you, Stefano, that vaccination is a right, but it should be a right during pandemics, but it is not, unfortunately, is not under the current system. In countries like Haiti, for example, they still need donations urgently. I mean, they can say that we have the right, but they don't have the vaccines. So yeah, sometimes we feel like, okay, charity is not the solution. But right now, Haiti is at the very bottom in Latin America in terms of access to vaccines, not just in Latin America. I think it ranks number 3 in the bottom globally in terms of access to vaccines. So it's a situation in Haiti, it's a desperate situation in Haiti, not because just the natural disasters and the killing of their president, but it's a situation chaotic there. COVAX was an excellent idea. Nobody doubts that was a great idea. But it was a great idea with very little impact right now. They have little to deliver. They have delivered probably 10% of the vaccines being used right now globally have been delivered by COVAX. So the expectations were so big, but the delivery of vaccines has been so low that, again, what it needs to happen right now is a new global health convention, a new global health deal, a new global public health agreement where countries agree that things need to be done differently. And one symptom right now, unfortunately, a deadly one, is not just the pandemic, but the access to vaccines. So there was this panel, the IPPBR, and also we had a publication before the IPPR recommendations at the Lancet. We were recommending a new global public health convention for the 21st century because of the situation of COVID, of this pandemic, something probably above WHO that can assure and ensure that the right things need to happen in terms of global public health, that countries do the right things, because as you said, Stefano, vaccines should be a right, but they are not, and it is not working like that way. So many countries are coming back to these ideas of nationalism, and we should close our borders and secure our own vaccines for our own people first before thinking on the rest of the world. And that's why the system is not working. That's the way we see, many of us see. The global public health system is not working right now, and we need something new. We need reforms, we need restructuring in order to assure that this won't happen again. And of course, this needs to be solved right now. I'll leave it back to you, Stefano. Stefano? Probably he got disconnected. Stefano? I don't know. I can keep talking, but I think I need to leave some floor for others.
One thing I can say again, thank you, Jorge. As you mentioned, is very chaotic for Haiti. So I think this is something I guess we all needs to, work together. Like I say, all the G20 countries, I guess they should unite and ensure, us like the neighbors get the equitable access to the vaccine, because this is one of the, like you say, we are really on the bottom part of the world, not just the Caribbean. So this is one of the things, or G20s, countries or, neighbors needs to really think and see how we're gonna get this done as quick as possible for us in Haiti. Thank you.
Yeah, I agree with you, Karin.
Yes.
I don't know, Stefano, if he's back. Or probably someone else wants to comment.
I think, let me, as we wait for Stefano to come back, I'll go in and talk about, Jorge, you talked about some treaty or some governing document. I don't know whether you're referring to the pandemic treaty that has been a discussion going on, although that's largely going on within the ambits of WHO. And I think the bigger concern is that, and to be more polite, there are people who argue that WHO does not have the teeth to bite. And because of the lack of those teeth, then what comes from most of them is mostly statements around, we need to see vaccine equity, we need to see sharing of technology, but then that doesn't seem to have action. And many people feel that if you have a binding pandemic treaty, maybe that may be the trigger that civil society and others can use, even if it means going to court in your national country, to be able to put pressure on your respective countries to be able to ensure there's equity, there's transparency, and there's sharing of resources and technology whenever we have another pandemic, whether it's COVID, whether it's something else. But I think there needs to be something legally binding that helps govern how countries in the world behave, because the behavior we've seen here has not been appropriate and it continues to happen. And it's more like people have moved on with their lives while a section of the world is desperately calling out for help and no one is hearing that call. It's business is going back to normal in many areas, but in other areas, people continue to get buried, families continue to get orphaned, and it seems like no one extremely cares. I think we have Stefano back. We shall stop being co-moderators.
No, thank you. No, thank you for helping me, because I think I had the problem with the Wi-Fi, but I listened to some pieces, but then now I'm back. No, you know that, for example, one thing that is happening or may happen is after the IPPR, paper and the Monti Commission and the high-level financing panel that was set up by the Italian Minister of Finances, the world is trying to propose a kind of global health council, global health board, whatever, that may help WHO, that I think personally that didn't work perfectly. He has to be reformed, but he has to stay, because this is the only, in a sense, public health institution of the world that we have. Maybe he has to be changed. He has to be refunded, but still, I am a little scared of duplications, like many countries, even of the G20, are saying. Please do not duplicate. Do not complicate the already complicated global health architecture, because it's already very complicated. There are a lot of private institutions, actually, private, but although, let me say, doing good, which are in the game. And we need someone that, or something that keeps things equal, let me say. So we cannot go from WHO towards only philanthropies. You know what I mean? So philanthropies are very good, are important, but they are philanthropic. We need to change the system that didn't work this time. So I would like to know your thinking.
Yeah, I agree with you. Sorry to jump on this, Stefano, but I agree with you. I mean, and also with Alan, that this new treaty or convention or whatever, the new way of seeing things in terms of public health or global public health needs to be legally binding. So countries, they do the right things in the right time. And in the case of that you mentioned it, Stefano, that we don't want to destroy WHO, but we think needs to be profoundly reformed so they can have the things that they don't have right now. They have a lot of limitations imposed by the same countries, and probably in some cases it's about the leadership there, but I won't touch on the leadership right now. It is about a lot of limitations they have. When you know that your bosses are the ministers of health of countries, are you going to criticize a country doing not the right things in terms of public health? Of course, you are going to just convince them, use a lot of diplomacy, but you cannot force them. Even when WHO tried to do that, like an investigation in China to see the origins of COVID-19 or SARS-CoV-2, China say no, we don't want such an investigation, and then delay the investigation for almost a month to start. And then they were not open and they were not transparent. So WHO couldn't do anything in order to get it. So those are the limitations. And I'm not saying anything against China right now. I'm saying that all countries have this kind of idea of sovereignty, but in terms of a pandemic, a global disaster, is a human responsibility. It goes beyond borders, it goes beyond countries. So someone needs to assure that those rules, the global rules, are in compliance and are enforced for the benefit of everyone. So if it is happening in Haiti or Uganda or Kenya or Italy, it is a global responsibility because it's transmissible. So yes, I agree with you, Stefano, that we don't need duplications, but we need the right structures, even if they need to be profoundly reformed in order to have the right tools and the right capacities to do the right things. I mean, there are some other organizations like the World Trade Organization that they enforce rules in terms of trade. Like, it looks like trade, yes, that's a global priority number one. If someone violates the rules of trade, they suffer consequences. Even the United States has been punished and they have been sanctioned because of violating trade rules. Nobody dares to sanction the US because of public health.
Absolutely. This is, I totally agree. WHO needs to be reformed, but he has no power in a sense. What he puts forward are suggestions. I remember when we did a lot of work for HIV, that was very well received by the countries, but these were, in a sense, suggestions, high-level suggestions, but not orders. Now, countries don't like orders. This is unfortunate, but from a health, in particular circumstances, I think we need to order, like WTO, say, hey, this is what you have to do. If not, I will sanction you. And this is not possible today, actually. So even the new global health, whatever council, board, that thing some are thinking of, I don't know which power they may have. You know what I mean? It's a board that should put together finances and health. So the health say, hey, we need this, and finances put the money. Let's see the composition, the equity of the composition, the powers that they have, if they really have powers, and their relationship with the WHO, with the existing institutions that also deals with health, including the World Bank, UNDP, so there are others. So the architecture is already very complicated. If you look at the map of the global health architecture, is a disaster. It looks like a Pollock painting. I don't know how we can get out of this. And consider, because we are talking about vaccines today, that it may be that we will need to vaccinate the world again and again. So it's not just because of the variants. If we leave the virus alone, it will mutate. So it's in the interest of the rich countries to stop it. But if this happens, that will be continuous mutations like the coronavirus does, the RNA viruses also. We may need vaccines for years and decades. And maybe not only for coronaviruses. So really we need to think, to be imaginative and have a vision of the future. So let me go back maybe to our Prince Manvendra. You want to add something?
Yeah, I want to add something important. We've been only talking about COVID and Corona and all that, but I feel that because of so much of importance and so much of time has been given on Corona, which is of course very important, we should not forget the other part which is HIV, and which is as when I talk about India, especially, India, as you know, ranks third highest in the world with regards to HIV infections. So I would like to say that I'm proud that I'm part of AHF India Cares, where we did not neglect our clients, our HIV positive patients. In India Care was the only organization in India which was reporting to the government about the antiretroviral treatment given to the clients even during the lockdown. We had the lockdown in as I mentioned last year as well as this year, but we were the only organization which was reporting this, and we ensured that our clients didn't suffer. They could not step out of their homes, so we provided courier services to see that the treatment reaches the homes of the clients, even reaches in some cases nearby the homes to ensure the confidentiality. We distributed dry ration kits to almost 800 of our clients. We also mobilized 2,000 protein bars which were distributed to children. So, and in spite of 50% of our staff was infected, still we had our uninterrupted services during the lockdown. So I think that this is something which we should also side by side consider. And talking about LGBT population, since I'm a LGBT rights activist, a lot of us have suffered because of working from home. And I have been personally handling so many cases, counseling cases coming to me from the LGBT population who have been tortured and tormented by their parents. Because in India, as you know, the parents play a very important role, and for forcing them to get married and many other issues coming up. So those also some issues we have taken up during the lockdown period. So I think we need to of course need to prioritize on COVID, no doubt, but we need to also balance out on other health issues and of course HIV, because it's an important part of each country and each culture. So that's something which I would like to submit.
Thank you indeed. But even in Europe and in Italy, we had problems with our HIV because, again, I come from the HIV field. We had problems with the care of HIV persons, also because the places where they were followed are the same of the COVID patients. So in a sense, it's a double problem because we also had problems with cancer patients during the lockdown, but not only during the lockdown. The hospitals were overwhelmed, and closed sometimes to other diseases. And in Africa, HIV people was, of course, very much touched and hit by the COVID pandemic, as you said. So we cannot forget that we still have HIV ongoing and the other pandemics and other emerging, or let's say re-emerging issues that we have still, that COVID-19, of course, as you said, it was a priority, but in a sense has obscured a number of other problems like antimicrobial resistance, which is growing and will be one of the next epidemics. And so this is why we need to be calm but also be prepared for the future. Now, what does it mean, preparedness? Jorge, what do you think? Or Alan, what's your definition of preparedness? What we should do, apart from working on up today? Because then I'll stop. We are a lot talking about preparedness, but we have a problem today. So that's a true and danger which is here.
So let me give it a shot because I know we're almost running out of time. But in terms of pandemic preparedness, I think we start by first looking at the country itself. How has a country structured its health system? What investments are they making to strengthen their health system? What are they allocating to their budgets for their citizens? Because we started off on the premise that health is a human right. So that becomes the responsibility of each country to ensure, what am I putting in place to ensure I'm preventing my citizens from getting disease? When they do get disease, I'm ensuring they're treated and I'm ensuring they're living a healthy life and healthy diet so that they don't fall sick. And if we do have pandemics, I have a strong health system that would be able to resist or fight back the pandemic to the best of their ability. And also from a trade side, I have helped increase local manufacturing of some of the goods and raw material that I need to be able to develop some of these things. And then when you now move upwards to the regional and the global level, we then want to question the global health architecture that we have from now. Is it actually working? Funding through the Global Fund, funding through PEPFAR, funding through WHO, funding through the World Bank. For all the years they've been around, an independent and quality assessment needs to be done. The way we are funding health from the global going down to the national, is that really working? or do we need to relook at it? Because every vertical program, be it the Global Financing Facility, be it PEPFAR, be it Global Fund, has a component called strengthening health systems. And if all these processes were working well, then countries would have had the strongest health systems possible. But what COVID has unveiled is that it has actually disrupted that health system, such that the gains made even in vaccinating children, the gains made in getting mothers to give birth in hospitals, the gains made in ensuring people have access to ARVs are all being lost because of the disruption that COVID has brought. So we need to have that fundamental question as we go forward to ask ourselves, is the current global health architecture actually doing what is right? And what do we need to change to be able to ensure that the way we fund global health goes towards strengthening national health systems? Because stronger national health systems means a better global health system. And the question then becomes, if every philanthropy, every donor, whether it's Gates, whether it's anyone else putting money into a fund, how sure are we that the money is actually going down to serve the communities, to enable the communities to hold their governments accountable to provide for them, but also to strengthen that particular setting? And I think for me, that's the concern, because also within the period of this pandemic, one thing that has been a major pandemic has been the violation of human rights, corruption and leakage. People have hiked prices of sanitizers, of masks, of things that would normally be very cheap, but now they become expensive, and others have become millionaires. We have seen some authoritarian governments not respecting human rights and using lockdowns, using curfews as a way to attack LGBTI groups, as a way to attack women and vulnerable people, and as a way for police to use excessive force. I think these are questions we need to ask ourselves. If another pandemic happens, now that we've even done away with COVID, what are we actually doing to be able to see the mistakes we have made? We start fixing them and thinking through in a systematic way. And this discussion, right, starts at the country level, escalating to the global level. It's not a top-down approach. It's an approach that requires all levels of the health sector, global, regional, national, and even to the district level, having conversations and people being on a table as equal partners. As it is now, it's more of a top-down approach. WHO has said this is the way to go. Everyone has to follow that way, irrespective of what may be working better within your country. And so we need to find a way where all states are treated equally, and conversations happen to come up with a meaningful pandemic treaty that can guide us to know exactly what are the principles that guide us when we have a pandemic, and how should everyone be able to behave in terms of going forward. So those would be my reflections, Stefano. Over to you.
Thank you very much, because indeed we are talking about this new pandemic treaty, and it's true that it should be binding. And some questions I have in the chat also deals with, for example, the accountability problem. So this is an old story. Who looks at the accountability of donations or things that has been done? You were talking also about WHO saying what has to be done, but unfortunately, as Jorge said, WHO sometimes can issue suggestions, but cannot order, to wear or not to wear masks. You know what I mean? It's just to make a stupid example. I would like to come back to Karin, because it's a long time that we don't hear you. Karin?
Yes. Hi. One thing I can say, it's been a very, informative. One thing Alan just mentioned, which I think that's one of the most important things, is the investment in the health system in each country. And with the WHO, we're saying it's from top to bottom, whatever they say, we have to follow. But I think each country all countries should be treated equally. Because right now, as we can see during those pandemic, we need to know, like, for the next one, I guess, we prepare how it's gonna be solved. Because right now we're heading to our second year with that COVID pandemic. And as we can see, some of the country is still learning or the system, what is the COVID, what is even the vaccine, introducing the vaccine to the country, to the people, so that's one thing I think it's very important right now if we're gonna really work on it. And I guess with the health system going on right now, if it's gonna be for everyone, like with the WHO, it has to be something like each country, they all do the same thing. It's not like this one is left out. Now this is why I feel like, especially right now, as we say in Haiti, is on the bottom. And we still like doesn't even have, we can say, the people, when you ask them for the vaccine, they still having concern, really, what is the vaccine? So this is why I was saying that we need a campaign doing the education, and even the government itself need the support from everyone, really, with us not having the vaccine is one thing, and the education, the campaign to really know how important it is to have the vaccine. So this is one of the things I think this is very important. As we're saying today, there needs to be a lot of changes in the system, really, especially we have learned a lot from that pandemic and hope that mistake cannot continue to happen. And as Prince Vendra has mentioned, we cannot forget HIV. Like I'm the country program manager for AHF in Haiti. And during the pandemic, we had the lockdown also. And we were able to ourselves to really take treatment to their home, because that was one of the important things. We were worried about losing, our patients. And really, like I said, Haiti, that's one of the things we really, really concerned with the education, with the campaign, learning. When things happen, we always, I guess, like I said, mentioned at the beginning, in the back burner, like what it's really going on with that pandemic. And we had different pandemic before. We had the cholera. That was one of the huge one where we had thousands of people dying. But it was very tough for Haiti because we didn't have so many support, or maybe not using the word donation, but coming to help them. And the same thing as the COVID-19 right now, we are having the same issue. So this is, I'm hoping that we can really find a way so we can not be on the bottom this time. At least we can move on with the education, the awareness, and get the vaccine to Haiti. And also we can make a change, hoping by the end of this year, so we can see a change in Haiti with the COVID-19.
This is the same that we hope for Haiti. I tell you, very much. We follow this country very closely. But I don't know what will come out from the G20, let me say. There will be a declaration, of course. Let's see if our prime minister will be able to cope with the different, because I'm part of this little task force working between health and finances and producing a proposal for preparedness for the future. Although I always say, hey, we need to think about preparedness, but the problem is today, is not just tomorrow. We already have to use this strength now, because the epidemic is not over. Too many countries do not have vaccines, and they may not have vaccines also for the future, when we will need a vaccine per year. That's not, hopefully is not true, but it's possible, that we need to revaccinate the world. And that will be another problem. So COVAX will never be able to do. It failed already a little. The idea was great, as Jorge said, but it didn't work. Now, Jorge, you want to add something to this discussion?
Yes, one last thing from my side. I think there was an institution created specifically to prevent, prepare, and respond to pandemics. That was the Global Fund to fight AIDS, tuberculosis, and malaria. They were assigned 3 sizes of pandemic size problems. So I think instead of creating a new financial mechanism, for the world in order to fight or to prevent and respond and prepare for pandemics, the G20 can strengthen the Global Fund and work with them so they can include the other pandemics as well. I mean, they have a great opportunity there because they have experience, at least for developing countries. The financial mechanism model of the Global Fund works. They know how to deal with countries. They know how to convince them to co-invest in fighting 3 diseases. And also, they don't have they are not accountable only to government, but they have civil society deeply involved and technical partners. So as part of the implementing bodies, but also at the board level, they have voice in both civil society communities. There is a very good structure, a very good model that I think the G20 can do something about.
I could not agree more with you. I actually said this in public many times. I spoke with Peter Sands. You know that I'm part of the Friends of the Global Fund. So in a sense, we issued a note saying how, because China, for example, always say there is no need to recreate something new. It's true, because the Global Fund is already a miracle. At the beginning, it was tough. You remember the times, but then it worked, and it deals with pandemics. This is his job. The job of the Global Fund is to deal with pandemics, the existing ones. Now, he has a structure because any board that will be created needs then a structure. So we need to build another building in Geneva? I don't think so. The Global Fund already knows how to collect funds, how to fund projects, and is accountable, not only to the countries, but also to civil society. So in a sense, I think that, but what Peter Sands told me is that, you know, the board of the Global Fund is always worried to expand the mandate of the Global Fund. Say, no, stick, for example, US wants the Global Fund to stick with its mandate, not to go outside. For example, even for health systems, it didn't work too much in expanding enough. So my idea is to reinforce WHO, use the Global Fund at least for low middle income countries, and because in a sense they do preparedness already by helping, you know. This is something that, for example, Mexico government should tell the G20 because Mexico is there, so what you say makes a lot of sense. A short. Prince, do you have something to add?
I'll be very quick. I think we should all learn what this COVID has done. Good thing to this world. I think the COVID has brought the whole world together. I mean, we have all connected. It's kind of given us the virtual media. I mean, now look at us now in the 5 different countries. We are all together on one platform. So I think we should utilize this this opportunity, and the whole world needs to unite and come together. And I would like to quote a Sanskrit saying. The Sanskrit is one of the world's oldest language, and I'm proud to be part of that culture in India. This Sanskrit saying says Vasudhaiva Kutumbakam, and the meaning of this phrase is the whole world is one family. So I think if we all come together as one family and unite ourselves, then I think the pandemic, whether it is a COVID-19 or any other XYZ pandemic which comes or attacks us, we would be able to address it much better. Thank you.
No, in short, let's say, let's try to turn a catastrophe into an opportunity, because and learn from what happened. So we are really at the end. I think we need to leave. But Alan, would you like to close our little round?
I think you said it all, and the importance is we must see global solidarity, and we must ensure that COVID-19 becomes the watershed moment where the world decided to fix the health system once and for all, and not where we sunk deeper into an abyss of inequality, iniquity, and inefficiency with the use of health resources. So this is the time for the G20 to rise up and speak up to the occasion of fixing the health system of the world.
Indeed, thank you. I think we are. I spoke a lot, and I don't know if I did well my job, but we are 4 minutes late. Are you there, friends from AHF, online? You know our convener. I'm talking to our convener.
Loretta Wong.
Hey, Loretta, are you there, Loretta? Say hello to us and to the public. No, I think she disconnected. But so I think it's my duty to say hello, to thank you very much, and maybe to see you in Rome, some of you, shortly. And thanks for all the people that listen to us. And good luck, and have a very nice end of this week. Ciao to everyone from Rome, from Mexico, from Kenya, from Haiti. Thank you very much.
Thank you.
Thank you.
Thank you too for the moderation. Bye-bye.
And from Mumbai, sorry, I forgot Mumbai.